How y'all doing? Happy, what day are we? Tuesday? I wanted to pop on and I wanted to talk about COVID-19 and the effectiveness of face masks. So let's chat. Those of you who don't know me, welcome. My name's Tabitha Jane. Thank you for giving me a couple minutes of your time. And those of you who hang with me, thank you as always. I appreciate you all so very much. Now, this channel, I do a lot of different things. Talk about narcissism. I talk about insights and clarity, and then I also read tarot. So if anything resonates with you, if you find value here, please give me a thumbs up. And if you really enjoy my content, consider subscribing, because my intent in what I do is really just to make you think, to make you, give you insight and clarity, and also to help you grow within yourself and trust your own intuition. So I always tell y'all, don't listen to me, okay? I'm going to share with you. This has been a weird day. Energetically, I mean, like, the energy is just really strange. It's off the charts. I'm a Gemini, and I'm finding, like, things are, like, really odd. So if you're all Geminis and you're feeling it, trust me, you're not alone. Just saying. And if you're not a Gemini and you're feeling it, you probably have Gemini somewhere in your chart, which is why I don't do a lot of the astrological things, because we all have different signs in our charts. And I don't know, just, to me, I feel like that's confusing and distracting. Anyways, I digress. What's going on with these face masks? Well, first I'm going to tell you my perspective, my insight, and I'm not a doctor, I'm not a physician, I'm not a trained scientist, I'm not any of those things. I'm just a person who is listening, but then I'm going to show you some research, okay? And you take it how you want it. My intuition, this has been happening for a few months now, and I'm a little intimidated about coming forward with this, okay? I'm not going to lie. And if you choose to blast me, cool. That's your prerogative. That doesn't change what I know. But if you just look at it from a logical perspective, okay? When you take something and you cover up your face, right then and there, you've got moisture, heat from your own breath being trapped. That moisture, we all know what moisture does. It's a breeding ground for viruses and bacteria. And you're trapping that. You're now breeding anything. So then we got this stuff on our face and we're touching to constantly readjust. Your hands are contaminated. Just from a logical perspective. The other aspect is, like, doctors and physicians, dentists, they wear a mask not to protect the other. They don't wear it to protect themselves. They wear it to protect the other person from accidentally contaminating. If you are healthy and strong, you have no reason whatsoever to be covering up your face. Wash your hands, use common sense, disinfect and that kind of stuff, like you would any other cold or flu season. Hello. Sorry, I'm trying not to get worked up. I really do have a message to share. The other thing is, when you have your face covered and you're out doing any kind of physical activity, because that's when it is we're supposed to cover up our faces, realistically, your oxygen airflow intake is now dramatically reduced. Carbon dioxide is now getting trapped in because you're exhaling. I mean, come on. We all know basic science. You breathe in oxygen, nitrogen, all the other stuff. You exhale carbon dioxide. Carbon dioxide is a toxin to our physical human body systems. So that carbon dioxide is now being trapped as you're trying to go out there. You're trying to do the things. You're trying to do the physical labor, the manual labor, whatever it is, walking, shopping, or whatever. You're not getting a free flow of oxygen intake into your system. Again, I'm not a doctor or a scientist. This is just freaking basic knowledge as far as I'm concerned. But maybe this will resonate with someone. I don't know. And again, blast me. I don't care. I just need to speak my truth. So, you are not only restricting your oxygen flow, you are not only adding a heat moistened bacteria cesspool that you are constantly breathing in. You are also, doing a false sense of protection. When you are healthy and strong, you are not the one at risk. But you're putting yourself at risk. Consider that. You're putting yourself at risk. You're not allowing your body to develop natural immunities. You're putting your body into a state of stress because it cannot breathe the way it's supposed to. It's breathing in more carbon dioxide than it is intended to. So you're putting the cellular structure of your body into a state of stress, which increases cortisol levels, which weakens your immune system, which makes you more susceptible. Now, this is just my logic. Let's look at some data. I'm going to take you with me because I pulled up some research. No, not that. I'm listening to one of my favorite readers. But give me a second here. I'm going to switch this around and I'm going to show you some of the reports. And you can read for yourself. Well, maybe. Well, why this time it's not letting me? I was trying not to make this long and drawn out. There we go. Maybe. Come on. Seriously, phone. Well, nuts. It's let me do this before. Alright, well, anyways, I don't know what y'all are seeing. I hope you're seeing. I'm trusting and believing you're seeing my screen. So, this is VMG.com, and this is face masks for public during the COVID-19 crisis. Oh man, I really hope this turns out well. I really thought, how can I turn this around? I should be able to. Well, damn it, it's taking pictures, and I don't want to do... I don't know why it is not letting me. Okay, guys, sorry. Doing my best. Welcome to my bedroom. Hot mess, just like me. But anyways, I have a message to share. Hopefully this comes through. But yes, if you go and read their report, there is no single formulation of the principle that is universally adopted. The precautionary principle aims at preventing researchers and policymakers from neglecting harmfully or potentially harmful side effects of interventions. Before implementing clinical and public health interventions, one must actively hypothesize, describe potential side effects, and only then decide whether they are worth being quantified or not. Most scientific articles and guidelines in the context of the COVID-19 pandemic highlight two potential side effects of wearing surgical masks in public, but we believe there are other ones that are worth considering before any global health policy is implemented involving billions of people. Two potential side effects that have already been acknowledged are wearing a face mask may give a false sense of security and make people adopt a reduction in compliance with other infection control measures, including social distancing and hand washing. Inappropriate use of the face mask. People must not touch their face, must change their single-use masks frequently or wash them regularly, dispose of them correctly, and adopt other management measures. Otherwise, their risks and those of others may increase. Other potential side effects we consider are the potential volume of speech between two people wearing face masks is considerably compromised, and they may unconsciously come closer. While one may be trained to counteract side effect, this may continue to be more difficult to tackle. Wearing the face mask makes the exhaled air go into the eyes. This generates an uncomfortable feeling and an impulse to touch your eyes. If hands are contaminated, you are infecting yourself. And face masks make breathing more difficult. For people with COPD, face masks are in fact intolerable to wear as they worsen the breathlessness. Moreover, a fraction of carbon dioxide previously exhaled is inhaled at each respiratory cycle. These two phenomena increase breathing frequency and deepness, and hence increase the amount of inhaled and exhaled air. This may worsen the burden of COVID-19 if infected people wearing masks spread more contaminated air. This may also worsen the clinical condition of infected people if the enhanced breathing pushes the viral load into their lungs. Alright, that's just one. Let's read this one. Wearing a face mask could put you at greater risk for coronavirus. Why? And this is the Sacramento Bee News Nation. U.S. Centers for Disease Control and Prevention has now recommended that people wear face masks in public. Health officials say it's not because surgical masks are more effective at protecting people from viruses. They're not. It's because wearing face masks could help prevent infectious people who are asymptomatic from unintentionally spreading the COVID-19 virus. World Health Organization has not changed its position, which says face masks are not needed in public for those who don't already have the coronavirus. Alright, you guys can look that up and read it for yourselves. Okay, this is Science Daily. Cloth masks dangerous to your health. The widespread use of cloth masks by healthcare workers may actually put them at increased risk of respiratory illness and viral infections, and the global use should be discouraged. The results of the first randomized clinic study or trial to study the efficiency of cloth masks were published in the journal BMG Open. The trial saw 1,607 hospital healthcare workers across 14 hospitals in the Vietnamese capital, Hanoi, split into three groups: those wearing medical masks, those wearing cloth masks, and a control group based on usual practice, which included mask wearing. Workers used the mask on every shift for 4 consecutive weeks. The study found respiratory infection was much higher among healthcare workers wearing cloth masks. The penetration of cloth masks by particles was almost 97% compared to medical masks with 44%. Alright, and then the last one I pulled up is CBC.ca News Canada. Use of masks wearing COVID-19 always the answer. Professional fears. People have false sense of security when wearing masks. Okay, gal. All I'm saying, you can look this up for yourselves. Here, let me get this back in the holder so I'm not giving you guys a bumpy, rocky ride. You can look this up for yourselves. I started looking into this because of my personal sense of logic, okay? And just, I'm not a doctor, I'm not a scientist, but I have a little common sense. And I know if we're not breathing right, it puts our body into a state of stress. I wondered, what else does that do? What does that mean? And then logically, we all know bacteria, viruses, they love a warm, moist environment to breed in. Well, when you're covering up your face, that's exactly what you are perpetuating. And then the other logical conclusion I have, again, this is just my own little sense of logic, blast me if you like. When we do not allow our bodies to be exposed and naturally heal, and naturally become immune, like the flu virus, like bronchitis, like the common cold, we allow ourselves to be more susceptible to a much more severe impact because we have no immunities. So, I don't know. I'm not saying I don't have the answers. And I'm not saying that the mask isn't right for those. Some yes. I'm not discounting anybody who chooses to wear a mask. Me personally, I haven't. I've chose not to. I'm not sick. I'm not at risk of making anybody else sick. I'm not being negligent. If I was sick, I'd keep my ass home. Just saying. I go and I do my job. I do take precautions. I'm not stupid. You know, I still have Clorox wipes. I still have some Lysol. And I'm a driver. So I've got a lot of random people in my vehicle. So I make sure it's sanitized and clean and, you know, we're all safe. But I just don't feel that wearing a mask is right for me. And I'm not saying it should be right or wrong for you. I'm not telling you what to do. But I'm just giving you some food for thought and a different perspective and some things to consider. Are you really helping yourself? When you're putting those masks on your children, are you really helping them? I think they should be out in the sun. They should be playing in the park, running out in the field, you know, getting sun, fresh air, exercise. That's healthy. You know, my dad and I gardened yesterday. That's healthy. We didn't wear masks, by the way. All right. I'm just saying, I don't know why. This just like hit me really hard today with like a really deep sadness. And it's something that's been on my mind for a few months, and I really didn't know how to say it. And I don't even know if this is coming across right. So again, there's no judgment. I'm not judging anybody for doing what they do, but consider what you are doing to yourself. That's all. Use your own logic. You're smart people. Think for yourself. And again, I wanted to share. I love you. I give you love, blessings, light, health, wellness, all that energy. Really, truly. Seriously. Send that energy to you. I hope this finds you well, healthy, and maybe gives you some clarity and insight. Do you, boo. That's all you can do. End of the day. All right. Love y'all. Thanks for hanging with me. Thanks for listening. And again, if you like this, if you like what I share, if you like my style, just give me a thumbs up. Maybe even consider subscribing. It helps me reach other people. And my intention is just simply to not judge, but to bring awareness and insights and perspectives, a different way of looking at things. And no right or wrong. So, all right. Catch you later. Bye.